Today we're going to be talking about one of the most important components of your nursing school application process, the interview. Now, not all schools offer an interview, and that's totally fine because sometimes it can be a little bit daunting to either sit down with somebody or respond to some questions virtually, depending on the format of the institution. Most commonly recently, we've been seeing, especially in the wake of COVID, a lot of interviews being conducted virtually over a video. So what will generally happen in those instances is you'll be given a prompt to respond to. And sometimes you'll get those prompts ahead of time, so you have the ability to kind of review them, sort of formulate in your head how you would want to respond, depending on when you actually do sit down in front of that video. And then when it comes time to sit down and film, generally it will be kind of like a one and done situation where you will sit down in front of your video camera and you will answer the questions either with a live individual or just in a pre-recorded setting, but you will most of the time only have the one chance to answer the questions because institutions don't want you to have the ability to kind of pre-record or go back and edit and change your responses. So the questions that you'll be seeing vary from school to school. No two schools have the exact same interview questions, and sometimes the interview questions vary from individual to individual. And the reason this is done is because they just want to ensure that nobody has an unfair advantage in being able to respond to these questions and having kind of, an idea already going into it what types of questions they're going to have. So sometimes the schools will prepare you in advance and give you a sheet of questions or potential questions, and other times it will just be kind of a random pool of questions that you'll be interviewed and asked to respond, and it might be different from student to student. So really it depends entirely on the institution. I've had students where they've been given the interview prompts in advance so they could prepare, and then they were asked about at least one of those options. Or I've had students who had absolutely no idea going into it what they would be asked, and they kind of just had to just go for it and see how it all turned out. So the most common questions that you're going to be asked in an interview are going to be things like, tell me about a time where you had an obstacle or a setback, either personally or professionally, and what you did and how you overcame that obstacle, just kind of to show resilience as a student in entering into the medical profession. Other questions will be about why you are choosing a career in nursing, so kind of giving an example of maybe an instance in your life that drew you to the profession beyond just the common phrase that is often heard, such as, I just want to help people, which again is a valid reason. It's important that when you enter into the medical field that you have a passion for helping other individuals, but that might not be, the most unique way to respond to that question. Another question that you might get is about your investigation into the school's core ethics and core values. So make sure you do your research. An institution might ask you, what core value of XYZ University do you align with most, and tell me why? So that's another big one. Questions about your medical background and your experience. What does nursing mean to you? What does a career in medicine mean to you? And then other questions such as, where do you see yourself in your nursing career? What are your plans? So those tend to be some of the more common questions that we see. In addition, we see questions such as, what, as far as diversity, equity, and inclusion, what are your viewpoints on that, and how can you enhance our community in those regards? So again, just thinking in the back of your mind in all of your responses to your interview questions, what can help differentiate you as an applicant, and how can you stand out? So those are kind of going to be the little individual pieces of you that you're able to share in an informal setting that can really shed light on the person that you are, the nurse that you'll be, and put a face to a name in an application, which isn't always the case. So I would say it's not common for every school to offer you an interview, but these are just some tips that will help you. So in addition to kind of preparing yourself in advance and trying to do your research as much as possible about the institution, another thing that you might want to consider doing is thinking about what looks good on a camera. So that would be like, what type of attire would you like to wear, trying to stay away from distracting prints and distracting colors, and making sure that your appearance is well kept. So making sure you brush your teeth and comb your hair before your interview. And then also lighting is key. So making sure that you have ample light in the background behind you to just kind of help make sure that you're illuminated and easily seen by your interviewer. And then just go in with the attitude that it's almost like a fun way to showcase who you are. So try to be playful, and it doesn't need to be something that's so serious and daunting and scary. It can be something as simple as framing it in your mind as just having a conversation with somebody. So those are just a few tips. Thank you and good luck.